Welcome back to Heart of Carolina Perspectives. So far this year, at least 36 people in North Carolina have died in house fires. Many of them, though, could have escaped if they'd only had a working smoke detector in their home. For the 12th year, ABC 11 Together is teaming up with Kidde, Home Depot, the North Carolina Jaycee Burn Center, and area fire departments, all to provide free smoke detectors to people in need. Joining us to talk more about Operation Save Life, we have Neal Zipser, the Director of International Marketing for Kidde, and then we have Dr. Bruce Cairns, the Director of the North Carolina Jaycee Burn Center at UNC Hospital. So, gentlemen, thank you for coming in to talk about this very important initiative.
Thank you.
So we'll start with you, Neal. If you want to tell us a little bit about what Operation Save a Life is, if you can tell us a little bit about how this works, if you don't mind.
Sure. Well, Kidde partners with ABC stations in about 12 different markets in the United States. And what we try to do is get smoke alarms in the hands of fire departments so they can be installed into homes that are most at risk, those of the elderly, low income, handicapped, and people like that.
Well, and we were mentioning, just all these deaths that could have been prevented. So why don't these people have smoke detectors in their homes? Well,
unfortunately, fire safety and smoke alarms are out of sight, out of mind. It takes a tragedy, unfortunately, for people to start thinking about smoke alarms. But in actuality, about 97% of homes do have smoke alarms. The question is, are they working? And it's recommended to replace smoke alarms every 10 years, replace batteries regularly, and even better, replace a smoke alarm with one that has a sealed 10-year battery in it so people don't have to worry about replacing those batteries.
And I'm glad you mentioned that, because that's something that we see in the news as well, not just fire deaths, but carbon monoxide poisoning. So to have one that does both is huge. And just to let people know the seriousness of these fires, I mean, Dr. Cairns, you see these injuries coming into the burn center, unfortunately. What kind of things do you normally see?
That's right, Kaylin. The burn center in Chapel Hill is one of the busiest burn centers in the nation. So this initiative is critically important for our people. We have a saying that the best way to treat a burn is to prevent it. And so the best way to prevent that is to have these smoke alarms and carbon monoxide detectors. And the way this gets done is through partnerships. And I just wanted to refer back to your previous segment and thank you so much for your support of the USO and Master Sergeant Fairfax and the folks that have served. We at Carolina are starting a physician assistance program that's going to help transition some of these special forces medics into civilian practice and work with us here in North Carolina. The other thing that we're going to do is the legislature, in a bipartisan effort, passed the Rare Disease Advisory Council legislation championed by many in North Carolina, the legendary political figure Rufus Evanston and others, to help develop advocacy, work with the advocacy organizations, as well as investigators and others interested in sort of addressing rare diseases and really transforming the way we do biomedical research. And all of this ties in with taking care of the patients that have these devastating injuries. We see a lot of grease fires and we see a lot of smoke inhalation injury research, another area that we're really focusing on. The problem is that if you don't have a smoke detector and it's functioning, you don't have an escape plan, your life can change in an instant. And it's critically important that we do as much as we can to help the citizens of North Carolina have these devices. And we really appreciate everything Kidde has done in support of the Burn Center.
Oh yeah, this is huge. And again, I bring this back to the news because we just see so many instances of these where entire families lose everything and unfortunately lose lives. I would assume that we're getting ready to go into the busy season for fires too, are we not? Does one time of the year happen? Do you see more incidents at a particular time of the year than others?
Yeah, unfortunately, most fires, I guess you could say, peak during the winter months when temperature gets colder for obvious reasons. However, you really can't predict when a fire occurs, where it occurs, so it's very important that people not only have working smoke alarms, but enough working smoke alarms in their home. Just make sure you have them in the bedrooms, outside the bedrooms, in the hallways, and outside the kitchen area.
Well, how many do you have to give away?
Well, we are going to donate more than 4,100 smoke alarms and carbon monoxide alarms this year. Again, it's the 12th year we're in Raleigh, and altogether through Operation Save a Life nationally, we've donated more than 1.2 million smoke alarms over the past 10 years.
Wow. Wow, and how long has the Jaycee Burn Center been helping out with these efforts? I mean, I know that you came in to talk about this last year too, so you guys are really on board with this as well.
It's been over a decade, and it's been in partnership with ABC 11, really getting the message out, and the technology has really advanced. You can see it's worry-free, so that the idea is get these smoke alarms in, save lives, and prevent people from coming to the burn center in the first place. We're really interested in using technology, not just in the devices that Kidde develops, but also with ABC 11 to targeting the demographics to really identify people who are at greatest risk. We think we can make a lot of progress. We've made a lot of progress already, but it's such an important initiative, and it really goes back to all these partnerships.
Yeah, and one life lost is too many.
Too many.
How can people get their hands on one? Where will these be available? How can they go about getting one?
Well, the best thing they could do is call their local fire department. Fire departments generally have smoke alarms throughout the year to install, so if you miss out after this month, just call them anytime. They'll come to your house, most departments in the area, and they'll be happy to install an alarm and go over some fire safety tips with your family.
And I would just advocate that people go, they can buy these at the store, think about a fire escape plan, hear the story, and then take it upon themselves to really prepare for this, because it always happens when you least expect it, and it's so tragic.
Yeah, and another important point is not only do you make your family safer, you also can reduce the risk that firefighters face when they get to a scene. They'll just be worrying about fighting the fire instead of rescuing people. So hopefully there'll be less injuries and less burn injuries of firefighters as well.
Is that something you see? Have you had firefighters come into the burn
Absolutely,
center?
and they're heroes, just like our military service people. They put their lives at risk to help save people, but what they ask us to do is to really develop these plans, work with the community. Burn prevention is the best way to treat these injuries and to keep our firefighters safe.
Well, we thank you both so much for coming in. Again, hats off to Kidde for this initiative and trying to make a difference in communities and get these into the homes of people who need them. So, gentlemen, thank you so much for coming in.
Thank you.
And Fayetteville Street is about to become a giant fiesta. Straight ahead on Heart of Carolina Perspectives, a celebration of the Latino culture. We have details on what you can expect at this year's Fiesta del Pueblo.